Hey guys, welcome to Ask the Doc podcast. I'm your host, Ina Esco. This podcast is brought to you by Lemoyne College and Ivy Multimedia, sponsored by Health in All Spaces Vaccine Equity Grant. And we are in Nashville, Tennessee at Meharry Medical College for the Spring Goes Pink Cancer Survivorship and COVID-19 Summit. And I've met some amazing people here today, plenty of medical professionals. Right now, I have with me Dr. Lawrence Burns. He is a podiatrist. How are you, Dr. Burns?
I'm doing great. Thanks for having me.
Thanks for joining me today on Ask the Doc. And the number one question that I have, Dr. Burns, is how did you get into podiatry? And tell the good people on Ask the Doc the definition of podiatry.
Sure. Podiatry is a treatment of foot and ankle disorders and problems. I got involved indirectly. When we came along in the 50s, we were sort of told that to be a doctor, you had to be a genius. So never even thought about being a healthcare professional. Went to college, actually chose business, and it was in my third year of business class that I thought I'd be in some building on a 20-something floor, and my boss would come to me and say, I don't like the tie you're wearing. Go home. And I sort of thought, I need to get a career where I have some independence and I can sort of determine my own way. So I switched over to healthcare, and I wasn't sure, be a doctor, be a nurse. And in the early 70s, when I went to college, there were not very many male nurses, and I didn't have anyone to talk to or give me any guidance in terms of what that career could look like. And so I thought I'll switch to medicine. And I went to my career counselor, and while I was waiting on her, I just looked through a little handbook, and I saw this career called podiatry. I knew nothing about it, and I sort of thought, if I take this, take that, I could qualify for that. And that's what I did. And one of the things that attracted me is that because it was different, I don't particularly like people dying under my care or around me. And so this was more like a 9 to 5. At the time in the 70s, doctors were basically living in the hospital. They were there all the time. And I wasn't the kind of guy that wants to get up at 2 or 3 in the morning to go deliver a baby. So podiatry looked like something different than life and death situations. And so I thought, I'll try that. And so here I am practicing about 42 years. My first 20 years were in Chicago. I taught part-time at the Podiatry College. It was called Illinois College of Podiatric Medicine. I did that 2 days a week, taught in the anatomy dissection lab, and I had a little practice on the side. And after about 20 years, I sort of thought, this should be a little more progressive than what it was. I felt like in Chicago with this college there were overabundance of providers, if you will. And so one of my friends that I trained with said, hey, come visit me. I'll come visit you. And so as a result of that visit, he asked me to stay in Nashville and help him with a training program. It was a podiatry residency program. And I thought, well, I enjoy teaching, and I haven't done that. And I'm looking for something different than Chicago. And so we actually moved here in 99. And so that's how I got to Nashville.
Wow. Now, Dr. Burns, as a podiatrist, what are some of the biggest issues that you see from your patients?
Painful ambulation, difficulty getting around. That could be heel pain. It could be arch pain. It can be thick ingrown nails. It could be a growth on the bottom of the foot. We call it a wart. It's a verruca. It's actually a virus. Those are some of the frequent things that comes in. But we also get tumors. And since we were at this convention today, the summit talking about cancer, I sort of thought, well, maybe I should let some of your listeners know about some of the common things that we see on the foot. Now, probably less than 1% of the malignant lesions affect the foot, but that doesn't mean you can stick your head in the sand and not look for them. I tell students, we don't look for pink elephants. Just do evaluations on a regular basis, and those things that are abnormal will stand out. What do I mean by that? The most common tumor on the foot is called a ganglion. It's a cyst. It's usually on the top of the foot, and it's a result of irritation by your shoes. and that cyst will go up and go down. It can stay around for quite some time, and we can diagnose that simply with an X-ray or an ultrasound, maybe even MRI if we need to. Some of the other tumors are fibromas. It's a fibrous cyst that's on the foot. Is very indurated, very hard, if you will. And sometimes they're painful as a result of getting larger, pressing on the surrounding structures, such as a nerve or a vessel, and causing some burning or tingling or, in general, discomfort. Those are some of the common tumors. But I have seen malignant melanomas, subungual melanomas, which is under the toenail, typically the big toe where it's turned black or it's striated. And I even had dermatologists send me patients and say, hey, we think this could be of issue. Could you do a biopsy of the nail and make sure there's not a melanoma? Melanomas are important because they can spread over the body. I've taken a few off of the lower ankle. I've had some squamous cells on the bottom of the foot. And so you just can't ignore them and think, well, there's such a small percentage, I don't have to worry about them, because there are some patients that's going to suffer with that condition.
Yes. And I heard you mentioned some of the issues are from certain shoes that you may wear, causing pain and issues. And, you know, a woman like me, I think of, okay, you know, now that I'm a little older, I don't wear heels like I used to, but they can cause some major problems, right?
Absolutely. And that's the majority of the people who are coming in with heel pain or arch pain. They say, Doc, when I get up at night or I get up in the morning, my foot is killing me, I'm limping. And typically they're wearing very poor supportive shoes. So we educate them on what to wear around the house, what to wear at work, to prevent those type of problems. As we get older, our muscles are not as strong, our ligaments aren't as flexible.
Not.
Yes. And what people don't typically know is when we walk, there's 1.5 times our body weight exerted onto the foot. So you take a 200-pound man, he's walking on 350 pounds of pressure. So whatever your weight is, take another half and add it to it. Typical person walks about 10,000 steps a day. So that's a repetitive trauma, and over a period of time, you can get chronic problems like a fasciitis, which is inflammation of the arch. You can get something called a heel spur, which is a bony projection onto the bottom of the heel that may or may not cause pain. We've taken x-rays on people and says, oh, you've got this huge spur. Well, I don't have any pain. And just the same, we take one and the person has a tiny little spur and it's killing them. And so the size is not the issue. But we find that wearing proper fitting shoes eliminates a lot of the problems.
Indeed, indeed. Dr. Burns, I'm a former athlete and I have 2 sons that are athletes. And of course, you know, I've seen probably quite a few injuries, have had to take them to the emergency room. But let's talk about the feet, the foot.
Yes.
They've had, I want to say my oldest son has had several issues with, I don't know why it's hurting, but it's hurting. When do you determine to take them to a podiatrist or the Campbell Clinic, for example?
Okay. Pain is not normal. So if someone is complaining about pain, then it needs to be evaluated. So whether that's a heel pain or arch pain or toe pain, it's not normal, and let's evaluate it and find out why it's happening.
Yes, indeed. And you know, these kids, they play these sports and it happens and you're like, okay, what do I do? So that's why I was wondering, was there, you know, a big difference in what the services provided by like a Campbell Clinic versus a podiatrist?
Okay. Campbell Clinic probably has a big group of orthopedic doctors. And orthopedics, they may have people who specialize in hands, feet, ankles, knees, hips, backs, necks. And so if you want definitive care of your foot, then a podiatrist is the person to go to. Now, there are some orthopedists that do feet as well, but they always do something in addition. So we think that since all we do is feet, that we're the specialists and we're the best person to see.
Yes, you are. Yes, you are. You've been doing this for over 40 years.
Yes, ma'am.
Amazing, amazing. Is there anything that you would like to communicate to the Ask the Doc audience that will let them know? You have a question? I have a young man in the room with me that is a community health worker. Come here, over here to the mic. We have a question live and direct for you. State your name and tell everyone your question. Talking to the mic.
My name is Rashawn Miller, and my question for you is, well, sometimes I'm just laying in my bed and I'll get a cramp in my toe. Is there anything I can do about that?
Just one toe.
Well, yeah, it's just one toe.
Which one?
My big toe on my right foot.
Yeah. Not sure what's causing that, but it could be overactivity where you've overused the muscles, and as a result, you're getting a spasm. That's a possibility. And it could be what we talked about earlier, ill-fitting shoes where you're not getting enough support and you're overstressing that particular joint. Those are some possibilities. But I would stretch that out, and if it's a little bit painful, I'd try some ice onto the area. I tell people 15 minutes on, 30 minutes off, but to tolerance, whatever you can tolerate. I like ice. It's anti-inflammatory. It reduces swelling, and if you leave it long enough, it'll become numb. It'll block pain. So ice is my go-to.
Ice is his go-to.
Thank you.
Yes, indeed. Well, Dr. Burns, any last words for the Ask the Doc audience that you would like to communicate about podiatry or anything in general?
It's been exciting in my career. When we first started, I started school in 74. I graduated in 78. We did not have MRI. And so I remember clinicians standing and snickering when a patient came in and said, well, I'm having all these issues. And they were like, well, we took an x-ray and we don't see anything. So he must be making it up in his head. But with the new technology, and boy, has it expanded over the 40 years that I've been doing this, it's so much better to help people and to find things that we didn't know we could see before. So I think the technology has grown considerably. Unfortunately, medicine is becoming very corporate, and I consider myself a mom and pop type organization, and corporations are basically taking over. So if they don't mind that type of work environment, then podiatry can be considered as a career for them. But I think the mom and pop days are pretty much done.
You think so?
The independent podiatrists, yeah, it's very difficult to compete against the groups.
Yeah, and then we have AI coming into the picture as well. Yeah. It's pretty, daunting to think about.
Yeah, but if you want something different, podiatry you should consider. And what's available now is we have internships where you can come and spend some time in the office and actually see what's done before committing to that career. I've had students come in, we take them to the operating room and give them that insight as well. So they have a very well-rounded view as in terms of what the career is all about, what the profession is about.
Great. Well, Dr. Lawrence Burns, I really appreciate you for coming on Ask the Doc. I know you mentioned you have some interns. Could you let the Ask the Doc audience know how they can get in touch with you and continue to follow your journey?
Absolutely. I'm currently teaching at Meharry Medical College. My email is lburns at meharrymedicalcollege.edu. If you have any questions or interest in podiatry as a career, feel free to contact me.
Awesome. Well, thank you so much for joining me today on Ask the Doc. Dr. Lawrence Burns, a podiatrist over here at Meharry Medical College. We definitely enjoyed you today. I'm your host, Ina Esco, and Ask the Doc podcast is brought to you by Lamont College and Ivy Multimedia, sponsored by Health in All Spaces Vaccine Equity Grant. Thank you guys so much for tuning in yet again.